Can you survive Tudor medicine's disgusting cures? 1. Lice drinks. Imagine going to a doctor in Tudor England because your skin had suddenly turned yellow, and being prescribed a cup of ale with 9 tiny insects in it. It sounds like a nightmare, but strange medical recipes like this really did appear in early English medical texts. Jaundice causes the skin and whites of the eyes to turn yellow. Tudor physicians often explained illness through the ancient theory of the 4 humors: blood, phlegm, yellow bile, and black bile. If someone developed jaundice, it could be interpreted as an imbalance involving yellow bile, and some historical recipes recommended surprisingly unusual ingredients. One recipe for jaundice called for ale containing 9 live lice, although versions of the recipe differ, with some references identifying the insects differently. The mixture was meant to be swallowed as a remedy. Today, we know that drinking insects would not cure jaundice. Jaundice can have many underlying causes, including problems involving the liver, gallbladder, or blood, and it requires proper medical evaluation. But Tudor medicine wasn't simply random. Physicians used herbs, diet, observation, and other treatments based on the medical knowledge available to them at the time. Live frogs and buttered spiders. Imagine having a terrible cough in Tudor England, and being told that the cure was to swallow a spider covered in butter. Respiratory illnesses such as severe coughs and breathing problems were common, especially in homes filled with smoke from open fires and with poor ventilation. But Tudor physicians did not understand the lungs and airways the way modern medicine does. Instead, illness was often explained through the theory of the 4 humors. Coughs and breathing problems could be associated with an excess of thick or cold phlegm, which was believed to obstruct the body. And this led to some remarkably strange remedies. Historical medical recipes describe using spiders in treatments for coughs and other respiratory complaints. In some preparations, spiders were coated with butter or mixed with other ingredients before being swallowed. Butter was sometimes used as a soothing or medicinal ingredient, while the spider itself was believed to have therapeutic properties. And spiders weren't the only surprising creatures to appear in old remedies. Frogs also appeared in historical medical recipes. Some preparations involved frogs being consumed or processed into medicines for respiratory complaints. To modern medicine, none of these treatments would be considered an effective cure for asthma or serious breathing problems. Skull powder. It sounds unbelievable, but human remains were sometimes used as medical ingredients in early modern Europe. One example was cranium humanum, or powdered human skull. Physicians and apothecaries believed that certain parts of the human body could have medicinal properties, and human skull was sometimes prepared as a remedy for conditions such as epilepsy, seizures, and other serious illnesses. The skull could be ground into a powder and then mixed into medicines or drinks. Some medical traditions also placed particular value on remains from people who had died suddenly or violently, although beliefs and recipes varied considerably between practitioners. And this wasn't simply an isolated Tudor superstition. The use of human remains in medicine continued in parts of Europe for centuries, appearing in medical writings and apothecary practices well into the 17th century and beyond. Today, of course, powdered human bone would have no accepted role in treating epilepsy or other neurological conditions. Fox grease and insect remedies for baldness. Hair loss was often explained through the medical ideas of the time, including the belief that the body's natural balance of heat and moisture affected hair growth. So physicians and apothecaries experimented with topical treatments designed to stimulate the scalp. Historical medical recipes included unusual ingredients, including animal fats and preparations made from insects. Some recipes recommended fats from animals such as foxes, bears, or other creatures, which were believed to have medicinal properties. Other preparations used irritating substances intended to stimulate the skin. Today, we know that irritation does not mean hair follicles are being restored. Some substances used in old remedies could actually damage or inflame the skin. But to Tudor practitioners, a warm, irritated scalp could be interpreted as a sign that the treatment was working. Cat blood and cream for skin problems. People in the Tudor period had many different explanations for skin diseases, and treatments varied widely between physicians, apothecaries, and folk healers. Some historical remedies for skin problems used ingredients that sound extremely strange today, including animal products, fats, and blood. There are also later folk traditions involving the blood of animals being applied to certain skin conditions, sometimes mixed with substances such as cream or lard. However, it is difficult to establish that cutting a black cat's tail or ear and applying its blood was a widespread Tudor treatment for shingles. What we can say is that pre-modern medicine frequently relied on animal-derived ingredients and topical preparations whose effectiveness had not been scientifically tested, and applying unsterilized animal products to damaged skin could obviously introduce contamination. The royal touch. Now, for one of the strangest treatments of all, what if the person treating your illness wasn't a doctor, but the king or queen? Scrofula, often referring to tuberculosis affecting the lymph nodes in the neck, was historically known in England as the king's evil. For centuries, people believed that English monarchs possessed a special God-given ability to heal it through royal touch. Tudor monarchs, including Henry VII, Henry VIII, Edward VI, Mary I, and Elizabeth I, participated in ceremonies associated with the royal touch. During these ceremonies, the monarch touched or blessed afflicted people, often as part of a formal religious ritual. A special coin or touch piece could also be given to the recipient. The practice was closely connected to the belief that the monarch ruled with divine authority and possessed a sacred healing power. Of course, the royal touch could not eliminate the underlying infection. And because some illnesses naturally improved or fluctuated over time, apparent recoveries could be interpreted as evidence that the ceremony had worked, shrinking tumors with a dead man's touch. In early modern Europe, the boundary between medicine, religion, and folk magic was very different from what it is today. Some people believed in forms of sympathetic magic, the idea that contact between two things could somehow transfer an effect from one to the other. This belief appeared in remedies for various physical problems, including swellings and other ailments. There are historical accounts of people seeking contact with the bodies of recently executed criminals for supposed healing purposes. In some traditions, touching or rubbing a swelling with the hand of a dead person was believed to help the growth shrink or disappear. The logic was strange but simple. As the dead body gradually withered away, the swelling was expected to do the same. Execution sites could therefore attract people looking for more than just a spectacle. Some visitors reportedly sought access to the bodies because they believed they possessed medicinal or magical properties. Of course, there was no scientific mechanism by which a dead person's hand could make a tumor disappear. Mercury poisoning. Syphilis spread through Europe around the end of the 15th century and became known by names such as the French disease or Great Pox. Without antibiotics, physicians had very few effective options. One of the most famous treatments was mercury. Mercury preparations were used in different forms, including ointments, pills, and other applications. Some treatments were designed to make patients sweat heavily or salivate excessively because physicians believed the disease could be expelled from the body. Unfortunately, mercury itself was highly toxic. Patients could experience severe irritation of the mouth and gums, excessive salivation, digestive problems, tremors, and other serious symptoms after prolonged exposure. And the treatment could become a terrible cycle. The disease was dangerous, but the medicine could be dangerous too. Eventually, modern medicine replaced mercury therapy with far safer and more effective treatments. Urine tasting. This was called uroscopy, and examining urine was an important part of pre-modern medicine. Physicians collected urine in a special glass flask called a matula. They examined its color, clarity, sediment, and other visible features. Some medical texts even included detailed urine charts showing a wide range of colors that physicians associated with different illnesses. But here's where it gets really strange. Historical medical traditions did sometimes include smelling or even tasting urine as part of diagnosis. A particularly famous example involved diabetes. If urine was unusually sweet, physicians could recognize that something was wrong. Centuries later, modern medicine would establish that excess glucose in urine is associated with diabetes mellitus, with mellitus meaning honey sweet. But uroscopy had major limitations. Physicians could sometimes notice real changes in urine, but they often interpreted those changes through the theory of the four humors, leading to diagnoses that had little connection to the actual disease. Pigeon slippers. In early modern medicine, fevers were often explained through the theory of the four humors. Physicians believed that excessive internal heat could build up inside the body and contribute to serious illness. So some healers looked for ways to draw this supposed heat away from the body. And this led to one particularly bizarre remedy, known as pigeon slippers. Historical medical recipes describe using pigeons as part of treatments for fever and other illnesses. In some versions, the bird was divided and applied to the patient's feet, while other remedies involved placing parts of the bird against different areas of the body. The idea was that the bird could somehow draw out harmful heat or illness from the patient. Of course, we now know that placing raw animal tissue against someone's feet cannot remove a fever or extract an infection from the bloodstream. But these treatments made sense within the medical theories of the time. And pigeons weren't the only animals used in strange medical preparations. Different parts of animals appeared in historical remedies for everything from fevers to skin conditions.